Okay, so I'm going to begin. Hello, everyone, and welcome to today's webinar on how to spot signs of a stroke in collaboration with Yocasta Corona of Trinitas Regional Medical Center. We are happy to present today's program. For those of you who don't know me, my name is Lori Arena, and I'm your moderator for today. And I'm also parish nurse here at Holy Trinity Church in Westfield, New Jersey. I always like to begin with a brief description of what parish nursing is because it is somewhat a unique field that many people may not know about. So if you don't mind, I just wanted to explain what parish nursing is. Parish nursing is also known as faith community nursing because it's not only in the Christian faith, it's in other religious denominations. And it's the non-invasive delivery of holistic care. So that's incorporating not only the physical well-being of a person, but also their mental and their spiritual as well. So just by being here today and empowering yourselves with more knowledge, that is part of your mental well-being. And spiritual well-being is very individualistic. So to one person, it may be the power of prayer and your faith, and to another, it might be meditation, or practice of yoga to fulfill your spiritual needs. Parish nursing is not a new field of nursing. As I mentioned, it's actually been around since the 1980s. But it's been gaining more and more popularity because of the recognition that it's getting in the media, and how literature has proven that when you deal with a holistic approach to healing, when you deal with holistic medicine, it leads to a healthier lifestyle. The program here started just about a year ago, and I was honored to have been the one that was chosen to develop the program. I did have some challenges, of course, like everybody else, due to COVID. So we found innovative ways to reach the community, and one of them being like through our Zoom webinars. So thank God for modern technology. Just a couple of things about the Zoom. We'd love to hear from you. So at the end, there will be time for questions and answers, and we'd love to address them. So at the bottom of your screen, there will be a chat box or questions and answers, and I will be checking that throughout the program. So please feel free to comment and to send any questions along, and we'll be happy to address them at the end of the program. Also, this will be recorded, and it will be available on the Holy Trinity website on the YouTube, under our YouTube. So it'll be there for future reference, and for you to share with whoever you feel might be interested in it. I also like to start with a reflection, but instead of what I was going to tell you, Father Anthony, who's the pastor of Holy Trinity, wanted me to share with you a short story that I shared with him this morning during our meeting. And I was telling him about my Sunday afternoon that I spent with my 85-year-old mother and her sister, my aunt, who's 83, and their best friend, who's also in her 80s. And what was only supposed to be a quick lunch, I went and got fresh mozzarella and some prosciutto and all the great Italian stuff from an Italian specialty store. What was only supposed to be a quick lunch turned into a 6-hour eating frenzy. And we sat around and talked and shared stories and laughed, and something that we hadn't done in a long time. And I felt that at the end of the day, I felt so much less anxious and so much less stressed. And they called me up in tears that it's something that they were, that they really needed at this time, and that they didn't feel they had to turn the TV on. And it just reiterated the fact that feeling less stressed and less anxious makes us feel good, and it helps us to lead a healthier lifestyle and hopefully less stress. It's been proven to lower our blood pressure and in turn help to reduce the chance of a stroke. So now enough from me. I'm here to present to you Yocasta Corona, who is the registered nurse and the stroke program coordinator at Trinitas Regional Medical Center, which is a primary stroke care facility. And Yocasta is part of a team which is responsible for delivering high quality stroke care, which is administered at Trinitas Regional Medical Center. And her presentation will be a discussion of how to spot signs of a stroke. So take it away, Yocasta.
Thank you.
You're welcome.
Let's share the screen. Okay. Good morning, and thank you for having me today. This was made possible by Arema, Parish Nurse of Holy Trinity, and underwritten by the Elizabethtown Healthcare Foundation. My name is Yocasta Corona, and I'm the stroke program coordinator at Trinitas Regional Medical Center. Most of us are worried about the coronavirus, COVID-19. However, it is important not to ignore stroke symptoms. The warning signs of a stroke are often so subtle that you can easily miss it altogether if you don't know what to look for. I hope your participation in today's presentation will help you understand more about stroke, risk factors, prevention measures, how to recognize the symptoms of stroke, and how to respond fast. There are no disclosures for this educational program. Someone in the United States has a stroke every 40 seconds, and this is according to the Center for Disease Control and Prevention. And someone dies from a stroke every 4 minutes. There are approximately 6.4 million stroke survivors living in the United States, and many with serious disabilities, including problems with speech, movement, memory loss due to vascular dementia, resulting in major lifestyle changes for survivors and their caregivers. The objective of this presentation is to help you understand the 3 R's of stroke: reduce the risk, recognize the stroke symptoms, respond by calling 911. Please know, stroke is one of the most preventable of all catastrophic medical conditions. Respond at the first sign of stroke and call 911 immediately. 37% of all Americans cannot accurately identify even one warning sign for a stroke. That's alarming. But after today, you will learn how to reduce the risk, recognize the symptoms of stroke, and respond fast by calling 911. African Americans have a higher prevalence of stroke and highest death rate from stroke than any other racial group. Those who have diabetes and have an ischemic stroke, which is caused by a clot, are more likely to be African American. Also, African American stroke survivors are more likely to be disabled and have difficulties doing daily activities. Not all of the reasons are clear why African Americans have an increased risk of stroke, but over 2/3 of African Americans have at least one risk factor for stroke, which includes hypertension or high blood pressure, diabetes, obesity, smoking, and sickle cell anemia. The good news is African Americans can improve their odds of preventing and beating this disease by understanding the risks and taking simple steps to address them. Get checked. Work with your medical professional on your specific risk factors and the things that you need to do to care for your personal health. Also, minorities have a higher stroke rate than the general population. It's very similar to that of African Americans. The risk factors that cause strokes continue to rise in the Hispanic community. Whether it's limited access to healthcare and resources, scientists don't know exactly why Hispanics have higher risk. However, they believe lifestyle and social factors may play a role. As per the Center for Disease Control, Hispanics have some of the highest rate of high blood pressure, diabetes, and obesity, which are leading risk factors for stroke. What is a stroke? A stroke is caused by an interruption in blood flow that supplies the brain. This is caused by a clot or a ruptured blood vessel. The brain is depending on continuous blood flow to provide it with oxygen and other nutrients to keep it healthy, functioning, and alive. When blood flow stops, the brain can't continue to function and the brain cells die. There are 3 types of strokes. Sorry. A little quick there with my clicker. Types of stroke. We have ischemic stroke, which can occur 2 ways, and they are the most common, accounting for approximately 87% of strokes. It may be embolic, which is when a clot travels to the brain from another part of the body. Thrombotic, a clot develops in an artery, and hemorrhagic. Hemorrhagic stroke is the second type of stroke which occurs when a blood vessel in the brain breaks or ruptures and bleeds. High blood pressure and aneurysms can make blood vessels weak enough to burst and bleed around the brain. While hemorrhagic stroke is less common, it's more deadly. The term brain attack is the most descriptive and realistic description of a stroke. It also provides a powerful call to action. A brain attack should warrant the same degree of emergency care as a heart attack. After all, your brain is your mind and your body's most vital and delicate organ. Immediate response is crucial because every minute matters. From the time symptoms first become noticeable to the time treatment is received. More brain cells die. In other words, time is brain equals time lost is brain lost. The best thing to do is to call 911 for immediate assistance. Treatment is available and some options are more effective if administered within the first 3 hours after experiencing symptoms. Your chances of walking out of the hospital with little to no disability are greatly improved if you receive appropriate treatment early. Unfortunately, it takes the average person in the United States 12 to 24 hours to get to the hospital after experiencing the first stroke symptoms. This is why it's important that everyone learns how to recognize stroke symptoms and how to respond fast. The most common stroke symptoms are sudden numbness or weakness of the face, arm or leg, especially on one side of the body. You may experience sudden confusion, trouble speaking or understanding, sudden trouble seeing in one or both eyes. Many times patients complain they almost feel like they have a shade that is placed over their eyes. There may be sudden trouble walking, dizziness, loss of balance or coordination, sudden severe headache with no known cause. If you see someone having these symptoms or experience any of these symptoms yourself, call 911 immediately. Appropriate treatment can be more effective if given quickly. Every minute matters. I can't emphasize this more. Time is brain. A transient ischemic attack, or a TIA, also known as a mini stroke, is caused by a temporary blockage and a serious warning of an impending stroke. TIA symptoms are the same as for stroke. TIAs are brief episodes of stroke symptoms that resolve within minutes or hours, unlike stroke symptoms which can last longer. Up to 40% of all persons who experience a TIA will go on to have a full stroke. Management of TIA focuses on preventing a future stroke. When a stroke occurs, what do? You act fast, F.A.S.T. Learn to spot the signs of stroke. FAST is, F is for face. Ask the person to smile. Does one side of the face droop? Ask the person to raise both arms. Is one arm weak or numb? Does one arm drift downward? Speech. Ask the person to speak a simple sentence. Is your speech slurred? Is the person using correct words? Is the person unable to speak? T is for time. Time to call 911. If you observe any of these symptoms, call 911 immediately, even if the symptoms go away. Appropriate treatment can be more effective if given quickly. Get them to the hospital immediately. Every minute matters. Again, time is brain. Stroke recognition. If you experience any stroke symptoms or you witness anyone experiencing the symptoms, again, call 911 immediately. Every minute matters. The sooner one is treated with life-saving treatments, the better the outcome. Check the time so you will know when the first symptoms appear. This is a vital information because that may determine whether this person may be eligible for our TPA or alteplase medication that is administered within 3 hours of onset. Again, every minute matters. The sooner one is treated with life-saving treatment, the better the outcome. The most common treatment for ischemic stroke is an FDA-approved drug therapy, as I mentioned before, called alteplase or TPA. We also call it a clot buster or clot dissolving medication that can improve outcomes, but only if it's administered within the first 3 hours of the symptom onset. Other treatments work by restoring blood flow with surgical endovascular interventions that remove clots that can mitigate or lessen the effects of ischemia, which is a restriction in the blood supply to the brain. There's also FDA-approved treatments available for hemorrhagic strokes, such as surgical clipping and coiling. The best way to treat a stroke is to prevent it. 80% of all strokes are preventable if you pay close attention to pre-existing medical conditions and control lifestyle factors such as diet and exercise. What's good for your heart is good for your brain. The American Heart Association recommends following Life's Simple 7, and this is to achieve ideal health. You can do plenty to make your heart and blood vessels healthy. Even if you had a stroke or have medical conditions that may increase your risk of a stroke, a healthy lifestyle plays a big part in decreasing your risk for disability and death from a stroke. There are behavior changes that we can control. This is by consuming less sodium. Too much salt may contribute to high blood pressure and make it more difficult to control it. Read nutrition labels on packaged meals. Many are high in sodium. Eat more fruit, vegetables, whole grains, fish, poultry, and lean meats. Lose excess weight with diet and exercise. Get physically active. Maintain a healthy body weight. If you smoke, stop. The first and most important step is making a decision to quit. Commit to stick to it. Smoking doubles stroke risk. Ask your family and friends to support you. Also, research shows that drinking large amounts of alcohol can greatly increase your risk of having a stroke. This is because alcohol contributes to a number of medical conditions that are risk factors for a stroke, such as high blood pressure, diabetes, and obesity. The National Stroke Association developed the following stroke prevention guidelines to help people reduce their risk for stroke. These guidelines are the gold standard used by healthcare providers in educating their patients about stroke prevention. And you can do this by controlling high blood pressure, which is the #1 controllable risk factor for stroke. Keep blood pressure under control by taking the medicine as directed and working with your healthcare provider. Find out if you have atrial fibrillation, which is an irregular heartbeat that can cause the blood to pool in parts of your heart. This blood can form clots that break off and cause a stroke. Your doctor can tell you if you have atrial fibrillation and help you manage it. Find out if you have high cholesterol. High cholesterol can indirectly increase stroke risk by placing you at a greater risk of heart disease. Talk to your doctor if your cholesterol is higher than 200, or if your LDL cholesterol is higher than 100. If you're a diabetic, follow your doctor's recommendations very carefully so that you can control your diabetes. Eat low sugar and healthy options. Diabetes increases your risk for stroke 2 to 4 times. Diabetes can also lead to circulation problems. In general, stroke is a disease of aging. The incidence of stroke increases with age, with the incidence doubling for each decade after age 55. Also, genetic factors are also known to be non-modifiable risk factors for stroke, with parental and family history increasing the risk of stroke. African Americans, Hispanics, and Asian Pacific Islanders have a higher risk of stroke than people of other races. So these are risk factors that cannot be controlled. Stroke among women. Stroke is the third leading cause of death in women. More women than men have strokes each year, in part because women live longer. Each year in the US, about 55,000 more women than men have a stroke. After stroke, women often have greater disability than men. A woman's risk for stroke is affected by hormonal status, pregnancy, childbirth, and other gender-specific risk factors. Oral contraceptives use, especially when combined with smoking and postmenopausal hormone therapy. Be sure to discuss your risk with your doctor. Risk factors such as high blood pressure, migraine with aura, atrial fibrillation, diabetes, depression, and emotional stress are stroke risk factors that tend to be stronger or more common in women than in men. A person who has had a prior stroke has a much higher risk of having another stroke than a person who has never had one. A person who had one or more transient ischemic attack, or TIA, also known as a mini stroke, is almost 10 times more likely to have a stroke than someone of the same age and sex who hasn't. You can reduce the impact of stroke if you work to reduce stroke risk. Follow the recommendations of the National Stroke Association Stroke Prevention Guidelines. Recognize stroke symptoms and respond by calling 911 fast. You can control your fate when it comes to stroke. Where can you learn more? You may learn more by visiting the American Heart Association, American Stroke Association website, which is dedicated to prevention, diagnosis, and treatment to save lives from stroke, America's #5 killer and a leading cause of serious disability. Thank you for joining me today, and I hope you've learned a great deal about recognizing the symptoms of stroke, reducing the risk, and responding fast, F.A.S.T, and calling 911. I can also be reached via email at whitecorona@trinitas.org if you have additional questions. But we will have opportunity for questions and answers and a little engagement right after this. Thank you for your time.
Yocasta, thank you. Thank you so much. Extremely informative. I don't see any questions yet, but I did have a couple of questions that some people had sent to me that weren't able to attend. So one question is, we know the signs of when you're having a stroke: facial drooping, arm weakness. But are there any signs that might happen before that occurs? Because when that occurs, you're already having an ischemic attack or a stroke caused by something. But are there any warning signs before that occurs that you might be aware of?
Not necessarily. Again, it depends. There's variations with our patients. Many times they come in and they say, you know, I've been feeling fatigued for several days, just not myself, a little foggy, not very specific signs and symptoms per se that may warn in advance that there's a potential. Other times when you have a patient that comes in with a very high blood pressure, they complain that they had a headache for several days. However, they may not have checked their blood pressure. They may have been non-compliant with their medications for blood pressure. So again, nothing really specific. Unfortunately, blood pressure, sometimes high blood pressure is silent. You may have that initial sign and symptom of a severe headache. Unfortunately, at that point, you may be symptomatic. So again, the most important thing is prevention. Prevent and address the risk before you have signs and symptoms. That's the most important thing.
Okay, thank you, thank you. Another question, can your brain heal from a stroke?
Very good question. Since strokes kill brain cells, they often can cause permanent brain damage. Current research suggests that some treatments can help the brain heal. However, scientists need more data to make a definite conclusion. So again, it takes time, depending on how large the stroke was and how the patient was affected. It may take longer, may take months or even years with therapy. Maybe a combination of physical therapy, occupational therapy, post-stroke rehabilitation, which is very, very, it's vital in order to establish and include restoring physical function and building strength, improving your cognitive function, and developing strategies to maintain post-stroke symptoms.
Okay, thank you, thank you. I have a question from Eileen. You mentioned circulation problems as a medical risk factor. If a person has cold hands and feet, probably known as Raynaud's disease, would this be an increased risk for a stroke?
Again, this is something that you want to discuss with your physician, again, to identify your risk factors and work with your physician to determine what treatment options are available to you based on your medical conditions and to prevent any future problems, especially if there is a risk for stroke based on whatever comorbidities or medical problems you have pre-existing.
Okay, okay. Thank you very much. Another question. Will I need to take special medications once I'm home?
Again, your doctor may prescribe special medications to prevent blood clots or additional strokes once you're released from the hospital. Again, you need to make sure you understand how often these medications are taken and what potential risks and side effects you may have so that you can report it to your physician. But many times, patients do go home on blood thinners. It could be something as simple as aspirin on a daily basis. Again, this will be tailored to your needs and your specific signs and symptoms and post-stroke treatment. Blood thinners such as Eliquis, aspirin, Plavix, or many times they may not be a recommendation for a thinner, but you may be on blood pressure medications, of course, if you had incidents of high blood pressure. So there may be very specific special medications ordered on discharge.
Okay, thank you very much.
Thank you.
A couple of people wanted you to know if you could please repost the contact information for the Heart and Stroke Association, if you don't mind putting that.
Oh, absolutely.
Thank you very much.
It has tons of information. It's an incredible resource. Again, it's, both sides are dedicated to prevention, diagnosis, and the treatment. And this resource is not only for patients, but also for caregivers.
Thank you. Let me see if we have any other questions. I do have another question for you. I was told not to take baby aspirin because I'm on Pradaxa.
Okay.
Do you
And
agree?
And that's, as I explained, every medication that's ordered, special medications that are ordered, are tailored to your needs. As I mentioned before, you may go home on an anticoagulant or even an aspirin on a daily basis, but it may be contraindicated based on other medications you may be on or other medical problems you may have. So again, that will be determined and tailored to your needs. Very specific, and that's the reason why you have to closely work with your physician so that you have everything that you need specific to you.
Okay. Please, if anybody else has any other questions, please send them along.
And you're welcome to send me additional questions via email. I'll post the email again. Here it is. It's whitecorona@trinitas.org.
Okay. Thank you very much.
Thank you. I really enjoy this educational webinar. I hope to continue this relationship with Holy Trinity, and it was awesome to have this interaction. Thank you all for joining me today.
I have another question, just a moment.
Yes.
Does low dose aspirin help prevent having a TIA or stroke?
Again, I'm not giving medical advice. This is something that you must discuss with your physician. Again, sometimes medications may be contraindicated to specific patients based on their medical history. So this is something to discuss with your physician if there are risk factors that may contribute to you having a stroke. Again, it's a recommendation, but it must be discussed with your physician so that you're taking something that it's okay for you to take. So please.
I know that years ago, because I remember with my mom, we're going back like 25, 30 years ago, her doctor told her, go on a baby aspirin. So she was on St. Joseph's baby aspirin for years and years and years. And when she started seeing the cardiologist, she was put on other medication.
Okay.
And she forgot to tell her that she was on this baby aspirin because it was so much a part of her routine. And she had issues that had occurred. And the doctor said, well, let me look through your medications. And then my mother said, oh, I forgot to tell you, I was on a baby aspirin. So it worked very well up to this point. But because she had a change of her other medications, high blood pressure medications, she, in her case, had to go off of it. But I see what you're saying, that it's yeah.
It's very important to share not only prescription medications, but also medications that we purchase over the counter, such as supplements, vitamins, because they may cause, it may be contraindicated based on the medications that you're currently on. Yes. So it's always important to have a list of everything that you take, whether it's prescribed or over the counter, so that your physician is able to review and determine what's safe and that there is no contraindication with other medications.
So thank you. Thank you very much. Thank you, everybody, for joining us. It was a pleasure hearing from some of you. Unfortunately, we can't see everybody, but so thank you for joining us. And Yocasta, thank you once again.
Thank you very much. It's wonderful. Thank you for all the questions. These were all great questions. I hope I was able to answer them. And again, if you do have additional questions, don't hesitate to forward them to my email. Thank you again and have a wonderful day.
Thank you. Bye, everybody.
Bye-bye.